apologizing to all of you who know workers' compensation well. I'm going to do a very quick introduction to workers' comp for people who are on the phone who know a lot about other social insurance systems, but not about workers' comp. Next slide, please. So workers' comp is our first social insurance system with its roots more than 100 years ago. And one of the driving forces for the first workers' compensation law was Crystal Eastman. Crystal Eastman, who did a study that was published in 1910 called Work Accidents and the Law, gave us a powerful description of the facts about workplace injuries and their financial impacts on workers in the Pittsburgh area. And it was her work that led to the passage of the first Workers' Compensation Act in 1910. Next slide, please. Unfortunately, in 1911, the New York State Supreme Court ruled that this Workers' Compensation Act was unconstitutional. The timing was really terrible because the day after this ruling, the Triangle Shirtwaist Fire in New York City killed 146 people. And 2 weeks later, a Pennsylvania mine fire killed 72 coal miners. And the next day, there was a coal dust explosion in Alabama that killed another 128 miners. These tragedies led finally to the passage and acceptance of workers' compensation in 45 states by 1920. Next slide, please. To give you an idea of the relative size of the workers' compensation systems in the United States, those systems are about half as big as Social Security, disability, and supplemental security income programs together. Next slide, please. So workers' compensation, as probably almost all of you know, is primarily a state-based system, and it's no-fault compensation for work-related injuries and illnesses. It pays for medical costs related to the injury and disability benefits that partly cover lost wages. Next, please. So it's important now with that little disappearing bullet because a lot of people are getting sick as a result of the COVID-19 pandemic. And we want to try to understand with you what the role of workers' compensation could be in such a system. And we have three terrific speakers who are going to talk about this coming up right now. The first of them is Debbie Berkowitz. Debbie is Worker Safety and Health Program Director at the National Employment Law Project. She was also Chief of Staff and Senior Policy Advisor at OSHA during the Obama administration, and is the former Health and Safety Director of the United Food and Commercial Workers Union. She's been a leading advocate during the COVID-19 pandemic for stronger worker protection. She'll be followed by Jeff Edinger, who's the Senior Division Executive of the Regulatory Division of the National Council on Compensation Insurance. Among other things, NCCI provides information critical to establishing insurance rates in 38 states. And Jeff is an actuary who's been with NCCI for more than 30 years. And he'll be followed by Melissa McInerney. She's an associate professor of economics at Tufts University and a research associate at the National Bureau for Economic Research. In her research, she studies both workers' comp programs and other issues related to workplace safety. So with those introductions, Debbie, please take over.
COVID-19 is spreading in the workplace among essential workers. The latest figures, for example, 34,000 nursing home workers infected with COVID-19, over 70,000 healthcare professionals, doctors, and other hospital professionals and nurses have reported are as infected, over 24,000 meatpacking workers, thousands of transit workers, just 3,000 alone, I think, in New York City. And other hotspots for worker exposure and infection are in the corrections industry, warehouses, grocery stores. For many workers infected with COVID-19 because of exposures at work, COVID-19 is an incredibly serious illness. In fact, the Kaiser Family Foundation just released a report that 1 in 4 workers are at a high risk of serious illness if they are infected with COVID-19. Black and Latino workers and other workers of color, including immigrant workers, are more likely to be in the frontline jobs, and these communities have disproportionate rates of illness and death related to COVID-19. Workers of color have a higher likelihood of underlying health conditions, which put them at increased risk of death or serious complications should they become infected with COVID-19. Workers need to be protected at work. It's not rocket science on how to protect them. For healthcare workers, it's protective equipment, triaging with infected patients, training, and procedures that need to be implemented to protect the workers and increase sanitation. For other workers, it's masks, social distancing in the workplace, stepped up ability to wash their hands and hand sanitizers, and notification. And there's also, contact tracing and testing are important for all these workers. But the federal government, I want you to know, next slide, please, has failed to protect workers from COVID-19. Employers, under the OSHA law, have the responsibility to protect workers on the job. They are supposed to prevent injuries and illnesses by providing safe conditions. The agency established 50 years ago to ensure that employers keep workers safe, who is supposed to have the back of workers, is the Department of Labor, and it's in the Department of Labor, and it's called the Occupational Safety and Health Administration, or OSHA. But in this pandemic, OSHA really has completely all but disappeared. They have refused to issue any specific requirements that employers must implement to protect workers. They could have issued emergency standards that would require certain protections for the most at-risk workers, healthcare workers and medium exposure workers or high exposure workers like transit and meatpacking and other of the hotspots, but they did not. They could have required employers of other essential workers to keep workers 6 feet apart, provide masks and face shields, provide hand sanitizers throughout the workplace, and the ability to wash their hands repeatedly, but they chose not to. That's right. They chose not to require employers to implement any of the CDC guidance to protect workers from COVID-19. The guidance is voluntary. Employers can implement the guidance or they can ignore it. The administration is saying we trust employers to do the right thing, but clearly all these cases in healthcare and all these cases in meatpacking and around the country make it clear that voluntary compliance is not working. In March and April, for example, OSHA did not conduct one inspection in healthcare or meatpacking, and in healthcare, they received thousands of complaints from terrified workers. This irresponsible and dangerous decision by OSHA has led to countless illnesses and deaths among workers. So not only didn't they issue a standard, but they've conducted almost no enforcement. For example, OSHA received a complaint from a meatpacking plant in Nebraska where there was no social distancing, not on the lines, not in break rooms, where workers are crowded in, and all OSHA did is send a letter to the employer advising them to check the CDC website. OSHA closed the case. Now 300 workers are sick. The same is true for thousands of complaints filed in the healthcare industry where OSHA did not conduct an inspections. So what you're seeing is that because there's no federal action, some states have been stepping in, and many of you may have seen this in your own states. Governors have issued executive orders to protect workers. Some are requiring masks at work. Others are requiring consumers to wear masks in places where workers interact with customers. Many of the executive orders require mandatory social distancing and septum sanitation and the ability to wash their hands and notification of workers. States like governors in New York, New Jersey, Illinois, Michigan, Minnesota, Nevada, Pennsylvania, for example. California already has a standard, the only in the country right now, to protect healthcare workers, and now they are expanding to protect all other essential workers. And Virginia is about to step up and have with Virginia OSHA to sort of pass a standard. And, you know, I just see a question here. It is not impossible to make work safe for COVID-19. As I said before, it is not rocket science. They just have to implement the basic CDC guidance. So workers' comp also provides a crucial source of healthcare coverage and income support for sick workers in this pandemic. And as you'll hear soon, it is often difficult for workers to obtain workers' comp for occupational disease. So since the beginning of the COVID-19 pandemic, justice states have stepped up to require protections that employers must implement to protect workers and mitigate the spread of COVID-19 at work, which then will mitigate the spread of COVID-19 out into the community and protect us all. Many states have recognized that the infection risk workers face from COVID-19 and have extended workers' comp benefits to them. Most of these states did this by adding a presumption, such as what was previously done for selected diseases in certain worker groups on other kinds of illnesses. To date, next slide, please. To date, 14 states have expanded workers' comp coverage for workers either through an executive order or legislation, and 9 more are considering them. Almost all did this by adding a rebuttable presumption that if you have COVID-19 for certain select occupations, it is presumed that you got this at work. Most states just cover healthcare workers, emergency responders, and some other limited groups. California actually covered all essential workers that were working outside their home. They have the broadest coverage. And states did this through legislation. Alaska, Minnesota, Wisconsin, and Utah did this by legislation. And the rest of the states, like Arkansas, California, Kentucky, New Hampshire, New Mexico, and others did this by executive order. I know that NAFSI has a wonderful paper just out about all the state activity, which I'm sure you will hear more about. So thank you very much, and I apologize, truly apologize for any kind of audio issues.
Okay, thank you very much for that presentation. And as was noted in the chat box, you can either use the chat box or the Q&A box if you want to give us questions. We hope to take the last 15 minutes or so to have a discussion led by questions from the audience. Our next speaker is Jeff Ettinger. And I have a couple of questions to lead into what Jeff is going to say. First of all, I'd like to know what NCCI has learned about workers' comp claims in terms of numbers and outcomes during the pandemic, and how much it expects to learn over the next few months. And the other question I have is, because NCCI does workers' compensation rate filings, it has to come up with estimates of benefit costs. How can it do so, and how does it deal with the uncertainties? Jeff, please take it away.
Thanks, Les. So the reporting, and you can go to the next slide if you want, actual COVID claims that have been happening, NCCI won't be seeing those types of claims in our rate, in our data collection streams until around the fourth quarter. Basically, you know, when a policy expires, we don't get the data for another 8 months after that policy expired. So claims that happen in, you know, March, April, May, really it's going to be the end of the year. It's important to remind ourselves that the claims is obviously not the only issue facing workers' compensation right now. We've got several. We've got mass telecommuting. And while telecommuting has been around for a while, never anywhere close to the level that occurred almost overnight. And there are a lot of workers out there who have never telecommuted. We've seen funny pictures of where people have their laptops set up. And so that's going to be interesting to see how that experiment works out. We have many furloughed workers who eventually are hoping to return to their jobs. We've got extremely high unemployment and a recession. And each of these things is going to impact workers' compensation, but it's very difficult, if not impossible, to predict exactly how they're going to impact workers' compensation. So as Debbie talked about, you know, compensability from the very beginning has been a question, has caused some uncertainty. And so what we're seeing is some states trying to clarify what is compensable, who is covered. So she already mentioned the state actions that have taken place. So next slide. A couple of things that NCCI has had to do with the furloughed workers, for example. There have been many companies who have told their workers, go home, you cannot do your job right now, but we'll continue to pay you until we open up again. And NCCI had to file a rule so that those payrolls could be excluded from the premium calculation. So if workers are off for 2 months before they come back, then those payrolls are excluded so that businesses are not having to pay workers' compensation premium for a time where their workers actually are not working. The other important filing that we made was to exclude COVID claims from the experience rating calculation because we did not feel that it was really predictive of workplace safety. Even, you know, within certain industries, you know, hospitals could be hit, one hospital could be hit much harder than another through no fault of their own, just based on their location or something like that. So, Les, when you ask about, you know, NCCI, we're in a position where we're expected to estimate the costs of this pandemic. And so one thing that we did was we created a tool and made it available to anyone for free, which basically takes NCCI data on you know, hospitalization, medical costs, and lost wages, and marries that data with infection rates, compensability rates, fatality rates, hospitalization rates, so that someone can try to figure out what the cost would be. I'm getting feedback. Somebody unmuted their phone. Now that tool has produced a very wide range of scenarios, but it offers states who are thinking about it or who have already taken some, you know, some action, a way to estimate what those decisions, how those decisions might impact the workers' compensation on a dollar basis. So NCCI is coming up on our, what we call our rate filing season, where we, in the summer, we make our rate filings that are effective January 1st, 2021. And we're going to have to make some decisions about how we estimate, or if we're able to reflect the estimated cost of COVID claims at this point, with the lack of any real claim data. So, okay, I mean, at this point, the good thing is the industry is facing this pandemic from a position of strength. So the workers' compensation results lately have been very good. And the other good thing is when I talked about the other impacts on workers' compensation may actually have a offsetting impact, a downward impact. So because so many workers went home or not doing their normal jobs, claiming activity at this point, other than non-COVID claims are down dramatically. So that's going to help when it comes to paying COVID claims. I have a question here that asks, is there any expectation that NCCI will recommend mid-policy rate increases? And so the answer to that is no, we don't have plans on doing that for a couple reasons. But one of them is the offsetting effects of some of these other things, so that it doesn't necessarily mean that we need rate increase. That's all I have, Les.
Thank you. That's very helpful. And there are a number of questions that came up, and we will get to as many as we can after Melissa McInerney's presentation. Melissa, the questions I have for you are, can you tell us a little bit about what we might learn from similar epidemics to help us understand the role of the workplace in particular in the spread of COVID-19? And also, I'm interested in looking at a bit at what the potential costs are that infected workers face if they don't have access to workers' comp benefits.
So we know that occupational exposure is important to the pandemic as a whole. And as states open up, more people are going to be going back to work, so more people might potentially be exposed. And this workplace exposure, is, as Debbie mentioned, is not only infecting the workers themselves, but is also likely contributing to the pandemic overall. There's some evidence from economics and epidemiology that predated COVID. So this is from a world when we weren't quarantining and we weren't shut down. And it shows how important the workplace is to spreading contagious respiratory viruses when the economy is open. So first, there's some evidence that traced social contacts of 7,000 individuals in Europe and showed that next to the contacts we have at home, the workplace is the second most set of contacts, social contacts that we have. So the workplace is likely going to be a point of spread. And then evidence from the US about seasonal flu has shown that when people are working more or more likely to be at work, there's more influenza in the community. When people are working less, there's less influenza in the community. So workers are really likely to be exposed to COVID in the workplace, and this exposure may be contributing to the spread more broadly. And this panel is timed really well, given that all these states are reopening now and a broader set of workers have returned to the workplace and are potentially facing this exposure in the workplace. So can you go to my next slide, please? And then I'll talk a little bit about new programs and how they may or may not help workers who contract COVID at work. So as Debbie and Jeff described, there are going to be challenges to covering workers who contract COVID, covering them through workers' comp. There are these other programs that are intended to help workers and families who are dealing with COVID, but many workers are going to fall through the cracks. So if we first think about medical costs related to COVID, if you think about the medical costs related to hospitalization from COVID, the Peterson Center on Healthcare and the Kaiser Family Foundation hospitalization from COVID could cost an average of $1,400. And research published yesterday in the American Journal of Preventive Medicine shows that expected out-of-pocket costs, not surprisingly, are even higher for enrollees who are in a consumer-driven health plan that has a high deductible, so costing closer to an average of $2,000. And then, of course, there have been several news reports of exorbitant medical bills for COVID treatment. We recently learned of a $400,000 bill for a woman in New York and a $1.1 million bill for a man in Seattle. So in response, 3 states, the District of Columbia, Massachusetts, and New Mexico, have required that all insurers in their state must waive cost sharing for COVID treatment. And 3 other states, Idaho, Michigan, and Minnesota, have negotiated with several of the large insurers in their states to do the same. And many of the nation's largest private insurers have voluntarily indicated that they're waiving cost sharing for COVID treatment. In many cases, this is for in-network care. But despite this, what I'm hoping to illustrate by the pie chart on the right is that these provisions are not likely to benefit the nearly 60% of private sector workers who are enrolled in employer-sponsored insurance, whose employer self-insures for health insurance. That's because the state mandates don't apply to them because self-insured plans aren't governed by state law, but are governed by the Federal Employee Retirement and Security Act, or ERISA. And the voluntary actions by private insurers to waive cost sharing don't convey to these workers either, because even though the enrollee's insurance card carries the name and the network of the large private insurer, the firm has really just hired that private insurer to manage the claims. So many workers, even those who have health insurance, might face substantial medical costs related to COVID treatment. And can you move to my next slide, please? There is also, as you'll see on my next slide, there's also the cost of time missed from work. If you see on, is it possible to move to my next slide? I'm so sorry. The Families First Act mandated that employers with fewer than 500 employees give workers who are quarantining or recovering from COVID 2 weeks of sick leave at full pay. Employers with fewer than 50 employees may apply for an exemption from this, but we've got 3/4 of private sector employees who work for the really large employers who are not mandated to provide this 2 weeks of sick pay, or work for the smaller employees who can apply for an exemption from this paid sick leave. And many of these workers, many of these 3/4 of workers who might not be covered by this paid sick leave from the Families First Act don't necessarily have paid sick leave from their employer. And this is especially true for the employees of the small employers if that employer has requested an exemption. According to the Pew Research Center, 36% of employees whose employer has fewer than 50 workers, it might be 39%, I'm sorry, don't have access to paid sick leave from their employer. And 9% of employees at the big employers don't have access to paid sick leave from their employer. So many workers don't have access to paid sick leave for the time that they're going to spend quarantining for or recovering from COVID. And then on my last slide, I'll talk about some very large programs that have been a part of COVID response, but I'm going to point out that these programs don't pertain to people who are still going to work, still putting themselves out there in the workplace. So another big support for workers was a part of the CARES Act, and it included some really important expansions to unemployment compensation. But importantly, these extensions to the unemployment compensation program don't benefit individuals who are still employed, still expected to be at work, and still potentially exposing themselves to the virus at work. There are two important extensions I'll talk about. The Pandemic Unemployment Assistance Program extends unemployment compensation to groups that typically aren't covered by UI, including self-employed workers, those seeking part-time employment, or those who otherwise wouldn't qualify for regular unemployment compensation. And there's also, the CARES Act also authorized the Federal Pandemic Unemployment Compensation Program, which provides a federally funded $600 a week supplement to weekly unemployment checks, and this is ending on July 31st. But importantly, neither of these benefits are available to two groups of workers who face risk in the workplace. None of them are available to the workers who are continuing to go to work and expose themselves to the virus because they are working, they are not unemployed. And these benefits, it is my understanding from my read of reporting on the issue and from the policies themselves, that these are not available to individuals who just might be concerned about the safety of their workplace and in response either quit their job or don't wish to return from furlough, if those workers are able-bodied, otherwise healthy, and have no caregiving responsibilities that would keep them from work. So these very important, very generous extensions to the unemployment compensation program don't help those workers who are still expected at work, or many of those workers who are worried about the conditions at work. So overall, while recent initiatives by the federal and state governments and private insurers provide many important protections, there are many workers who will still face high medical costs and no paid sick leave should they contract COVID at work. And that's all I have.
Great, thank you very much. Thank you to all of the panelists, and thank you to the audience for bearing with us through our technical difficulties. I would like to turn now to some of the questions that we received, and turn to the panelists to tell us what they can in answer. So one question we have is, what about workers who are sent home because they're symptomatic, but I guess may or may not have contracted the illness, the COVID-19 illness at work? Would somebody who's symptomatic but not disabled be eligible for workers' comp benefits? maybe let's assume for the moment that they would be covered if they were disabled.
This is Melissa. It's my understanding that the paid sick leave from the Families First Act would cover that for workers who are employed at employers who are mandated to provide that sick leave. So that could be provided outside the workers' comp system if your employer is providing that 2 weeks of paid sick leave, is my understanding.
Okay. Does anybody have a thought about whether this is likely to or should be covered under workers' comp? Maybe we need. Yes, go ahead.
So this is Debbie. I think what you're referring to is workers that need to quarantine,
Yes.
maybe because they have symptoms and are asked to go home, and maybe they'll develop a full COVID-19 or they're not. Now there's some, like Washington State created a presumption for workers that had to quarantine who were, there's some feedback, of the highest risk, like healthcare and first responders. You know, I think states really need to think about creating presumptions here, because occupational disease, and especially this whole concept of quarantine, is very different than, you know, in other illnesses. But so I don't, you know, so in some ways it may be a state by state question or answer, I mean, depending. In some states very clearly are covering quarantine, which is exactly that. Less, they may not be sick, or they may just have symptoms, or they may have just stood next to a worker. So I hope that answers the question.
Okay, thank you. Anybody else? That's a pretty tough question. So here's an NCCI question, which is, does NCCI plan to do any future analysis once they have access to claim data to see how well the things actually turned out in terms of their recommendations for or their estimates of what the cost would be?
Yeah, I would say that more along the lines of, you know, how long hospitalization was required, or you know, how much lost wages there were. So not necessarily, we don't really do estimates on what's the total system costs of COVID, because we do not estimate infection rates, or, you know, we don't estimate what percentage of the claims are going to be compensable. But we may be able to come up with quote, you know, the average cost of a COVID claim in the future. Whereas now we're really just kind of putting the pieces together, saying, you know, the average hospitalization rate is this, and there's a certain percentage where there's a mild case, there's a certain percentage are severe cases, certain percentage are fatalities, things like that. So yes, we will get a better picture of what the average cost of a COVID claim is eventually.
Okay, thank you. So here's another question. Is this all a failure of not having a unified social insurance system rather than each section, health insurance, workers' comp, unemployment comp, having its own confusing and overlapping rules? It's a yes or no question.
Having multiple different programs with different roles administered at different levels of government certainly, this is Melissa, certainly can contribute to some of the gaps. So as I looked at the different programs that are in response to the COVID crisis, clearly because they're from different pieces of legislation or run by different government agencies, there's groups of workers who might be left out of each of them.
I think there is, certainly in my mind, generally a question about whether workers' comp is really well set up to deal with costs like this, and whether the pandemic might lead us to rethink how our different social insurance programs are structured. That obviously becomes an issue for people who are working but not as regarded officially as employees, like as gig workers and self-employed workers who, by extension, this one time have gotten unemployment insurance coverage, but that's not happened to workers' comp. And maybe there is a better way of doing all this.
Les, this is Debbie.
Yes.
So I just wanted to say that one of the things that is difficult here with so many contested claims, I'm about to testify tomorrow at a hearing in Connecticut with so many workers that are healthcare workers that whose claims were denied, that you have the problem here where that health insurance says, well, I'm not paying, it's work related. And workers' comp, well, I'm not paying because it's not work related. And it would be good to have some provisions in the law that connected these two systems so that like your health insurer would pay, and then if it's later determined, that it is work related, that one insurance company can then, recoup the loss from the other. But I also wanted to add, I'd been looking at my computer to that one question about a quarantine. So there's some debate about, I guess, if you're quarantined by your employer because you have symptoms, you're sent home by your employer because there's some states that will cover it. But then in Alabama here, it says, what if an employer advises an employee that he or she must be quarantined because the employee may have been exposed to someone at work who has the coronavirus? Is this covered by workers' comp? And the answer is no, because mere possibility of an injury or occupational disease is insufficient to trigger the act. So, and that, so again, it's like a state by state kind of thing, I guess, is what I wanted to say.
So there, for people who can look at their webinar chat, there are some good comments from people who are attending the seminar but not on the panel. I'll just read a couple of them. One from Brian Zagman in Minnesota. In Minnesota, workers' comp is only available if the person is tested to be, under the presumption if the person is tested to have COVID-19. And then from Emily Spieler, there are a few states that are explicitly covering quarantining under workers' comp, but this is not generally the case. So, one thing is that this is a state-based system, so states are going to differ on this. So there's a question here that says, traditionally, diseases that are general in the population, like flu, have not been compensable. Should that be different for COVID? And if so, why?
Yeah, this is Jeff Ettinger. I mean, I think really this is really the key question that we're dealing with here, because when the lawmakers wrote the workers' comp statutes, they wrote it such that the injury was supposed to be arising in and out of the course of employment, but also in the area of diseases, it was supposed to be diseases. Let's say you would because of the work you do, like asbestosis or silicosis or black lung, something like that, and not ordinary diseases of life that you would have just as much of a chance as being infected outside of work as in work, because it'd be impossible to prove where you caught it. So I liken this a little bit to some of the presumptions that we've seen for, let's say, cancers and heart attacks in certain occupations like first responders, where states have passed bills saying if this worker contracts cancer or dies of a heart attack or has a heart attack, we're going to presume that it was work related because their job is so stressful. And I think, that's what we're kind of seeing in some states where we say healthcare workers, it's their job to deal with sick people. And so they are expected to come in contact with infected people. And so you don't necessarily think that a grocery store worker, that it's their job to come in direct contact with sick people. And so I think that's kind of the, when someone says, should it be, I think there has to be maybe a line drawn where it's kind of clear, or states have to basically, change the laws need to be changed to act, come up with the criteria for when it wouldn't be covered.
So I want to add to what Jeff said. This is Debbie. I agree that this is different than the flu, and it's much more like what Jeff said about states that have passed, certain provisions that if certain workers develop certain chronic illnesses like lung conditions, they can be covered by comp, and most of that, as Jeff said, has been like for firefighters, emergency responders, to get certain benefits from certain lung conditions. But so not only are healthcare workers and nursing home workers, even though they're being denied, and first responders, though I have to tell you, I'm on a panel tomorrow in Connecticut with healthcare workers who are being denied their workers' comp claims, even though there's a spread in their workplace in healthcare, that there should be a presumption. But also, I work with meatpacking workers around the country. You've got 26,000 meatpacking workers sick. It's spread like wildfire through the plants. You've got a plant with 1,000 workers sick. Many are dead. You've got plants with hundreds sick. You've got some grocery stores where you have multiple cases. And I really do think that a lot of these essential workers did not want to go to work. In the state of Iowa, the governor of Iowa said, you don't want to go to work, you're not going to get unemployment insurance. So, we sort of force them to work. And so now the state needs to make sure that if they get sick and they need workers' comp, that it's there for them.
This is Melissa, and I'll add on too, just pointing out that, as we all know, the second half of March and April was a very different world where most contacts people were having were probably happening at work, which is not the case during a typical flu season. I know I introduced my remarks by saying, even if we're just thinking about seasonal flu, the workplace is really important to that spread. But especially from the second half of March to the end of April, most people who were leaving their homes were likely just doing so to go to the workplace. So it was much more clear, perhaps, during those 6 weeks that it may have been a workplace exposure.
So there's a lot of questions. I almost wonder, and a lot of interesting things that the audience has to say. I'm going to ask one more question, and then I think we have to wrap up. The question is, if given an opportunity to testify before Congress, would you recommend making workers' comp a federal state program like unemployment insurance? I presume with the idea that this would create more consistency among the states, although I'm making that up. Anybody want to take a shot at that?
Can you repeat the question?
So the question is, unemployment insurance is a state federal program where the federal government essentially provides a structure within which the states work. Would you recommend, if you were asked to testify before Congress, that workers' comp be made a federal state program in that
Hi,
sense?
okay, I'm jumping in. This is Debbie Berkowitz. Totally. There needs to be some kind of minimum standards for workers' comp. It is a state program, and there are such huge differences by state. You know, you live on one side of a border, like in Ohio and Indiana and Kentucky, or you live in Mississippi versus Tennessee, and there are huge differences in workers' comp, and that just should not be. So I do think there has to be some kind of minimal standards on this. And I know who I've learned so much about, Les and Emily Spieler, and I think Glenn Shore is on this, you know, a lot of the people that have studied this, but I really do think, and, you know, yes, in this case, unemployment insurance, the states can always do better. Unfortunately, we have an administration now in terms of unemployment insurance that is taking not a worker-friendly view of things, but usually it's much better to have at least some state minimum standards, and I think that is really important.
Okay, well, I have to end this with a final question from the audience. Debbie, do you really want Trump in charge of workers' comp?
Well, that's what I said, but I...
Okay, that was, I think, a rhetorical question, so you don't need to answer it.
About federal standards now, and UI is being, but really some states are so horrible. So we need a better system, and maybe we need a commission to come up with good recommendations first, like we had back in the 70s.
Well, thank you, panelists.